When it comes to safeguarding the well-being of vulnerable individuals, few things are as critical as ensuring mental health facilities operate with the highest standards of care. So what happens when a facility repeatedly fails to meet even the most basic requirements? Minnesota is currently grappling with this very issue as it moves to revoke the license of a St. Cloud-based mental health provider after uncovering an alarming 47 violations during a recent review. But here's where it gets controversial. Should repeated non-compliance lead to the outright shutdown of a facility, or are there alternative ways to hold such providers accountable while still serving the community? The Minnesota Department of Human Services, DHS, issued a formal order on July 2nd to revoke the license of Bestwood Agency, a residential mental health service provider in St. Cloud. This decision came after a thorough investigation revealed significant lapses in compliance with state regulations. While the order has been appealed by Bestwood Agency, the facility is permitted to continue operations temporarily, provided it adheres to specific conditions outlined in the DHS order. A spokesperson for the DHS emphasized that Bestwood Agency's license is under appeal, and they may operate as an intensive residential treatment services (IRTS) provider only if they comply with the stipulated terms pending the final judgment. What makes this case particularly concerning is the sheer number of violations identified during the licensing review conducted in April 2025. Bestwood Agency was found to have committed 47 separate infractions, a sharp increase from the 26 violations noted in June 2024, just months after the facility received its license in January 2024. According to the DHS revocation order, the growing number of violations, coupled with recurring issues, demonstrates a troubling pattern. The agency is accused of failing to fulfill its responsibilities as a licensed provider, including maintaining proper oversight and ensuring staff members possess sufficient knowledge of applicable regulations. So what exactly went wrong at Bestwood Agency? The DHS report highlights several critical areas of concern. One major issue involved the failure to document essential health screenings for clients within 72 hours of admission, a standard practice designed to ensure timely medical attention. Additionally, the facility allegedly neglected to coordinate effectively with psychiatric and medical services, leaving gaps in patient care. Another glaring problem was the lack of proper documentation regarding adverse medication reactions and side effects. When the DHS reviewed 7 client files specifically for medication administration protocols, none met the required standards. As stated in the revocation order, there was no documentation to demonstrate the license holder coordinated the client's psychiatric or medical services. But the problems don't stop there. Bestwood Agency also offers financial planning assistance to help residents manage their funds securely. However, the DHS review uncovered errors in all 4 client files examined in this area. Specifically, the facility failed to properly document the safekeeping of funds or other property entrusted to them. 3 out of the 4 cases involved neglecting to record the receipt or disbursement of funds or belongings, while one instance involved failing to return medications to a client upon discharge. These oversights raise serious questions about accountability and trustworthiness in handling sensitive tasks. Another area flagged by the DHS was inadequate documentation of staff training. Ensuring that employees are adequately trained on psychotropic medications and their potential side effects is crucial before allowing them to administer drugs or monitor clients self-administering medications. Yet every single staff file reviewed for training documentation fell short of meeting these expectations. This finding underscores a broader systemic issue within the organization, one that could compromise both employee preparedness and client safety. Noor Yusuf, the authorized agent and owner of Bestwood Agency, has yet to respond publicly to the allegations. Attempts by the St. Cloud Times to contact Yusuf were unsuccessful, though a message was left with a staff member at the agency. With so much at stake, this situation invites important discussions about how best to balance regulatory enforcement with the needs of clients who rely on these services daily. And this is the part most people miss. What do you think should happen next? Should facilities like Bestwood Agency face immediate closure for repeated violations, or should there be opportunities for remediation and reform? Does the current system provide enough safeguards to protect vulnerable populations, or does it need a complete overhaul? Let us know your thoughts in the comments below. We'd love to hear your perspective on this pressing issue. For ongoing updates on this developing story and other important news, consider signing up for our alerts to stay informed and connected.